It's feared sick Tasmanians will feel the most pain from big budget cuts. The government says it will protect frontline health services from the impact of $500 million in cutbacks. But the budget papers tell a different story, predicting an increase in elective surgery waiting lists and longer wait times for ambulances.
More patients, but less money. Thousands more people are expected to turn up at Tasmania's emergency departments next financial year. At the same time, $100 million will be slashed from the health budget.
People deserve good health care and they deserve timely health care, and that costs money.
We will try to protect service delivery as much as we can within the Department of Health and Human Services.
But budget papers show predictions of waiting list blowouts for elective surgery and dental care and longer wait times for an emergency ambulance.
The government is virtually admitting that there will be an impact on service delivery, even though the Premier and the Minister both said that these cuts won't have an impact on service delivery.
The government says an ageing population and high rates of chronic disease means pressure on health services will increase regardless of the budget situation. The federal government's health reforms are also driving the push to keep costs down.
We are now going to be funded a set price for an activity, so we need to make sure that we are operating at least at or below the efficient base price for those services.
The government is putting together a business control team to find $500 million in cuts from health over 4 years.
It's a bureaucratic razor gang. And it's basically the politicians can then duck the bad news.
While unions are preparing for a fight, non-government disability service providers want answers as to why promised growth in funding from the federal government has not flowed through to them from the state.
The federal budget says X, the state budget says Y. We're just on the outside saying we desperately need more money.
One of the many sectors struggling to meet rising costs in increasingly tough budget times. Fiona Blackwood, ABC News.